Question for you, Mr. Tubbs. Do you support privatization of Social Security? And if so, why?
No. Yeah, I addressed that in my opening comments, and I'll talk about it some more because this is an excellent opportunity to talk about the future and how we're going to get rid of that red. You can't just say, let's get rid of it. You have to have a plan. You have to have some ideas. You have to have experience to fall back on. And like I said, I balanced a multi-million-dollar military budget that looked like that, with less zeros, but still looked like that. In the military, if you don't balance your budget, if you're the commander, you have the authorization of tax dollars, and you spend more than you have, you can go to jail. I'm not so sure I would be against such a provision for our U.S. Congress. That is somewhat tongue-in-cheek. But Social Security is one of those entitlements that is growing, that we can't afford if we continue on the path we're going. So many of these programs that we have are unsustainable. And if we don't do something about it, it's going to break for everybody. You know, I'll refer back to my 97-year-old grandma. She lives on her Social Security, and that's it. If we fail at the federal level, my grandma, my mother, me, your kids are going to suffer. That Social Security is going to be worth a whole lot less or not going to be there if we fail. So we're going to have to make some hard decisions. I'll tell you right now, I believe the age for Social Security needs to be raised. And my initial thought on that is 70 years old for full benefits. I know a lot of people who are 65, 67, very, very viable. I fly with 62, 3, 4-year-olds. We just raised the flying age from 60 to 65 because we're living longer. We're healthier. We're taking care of ourselves. We are still able to contribute to our society at these older ages. And this is one of the things that I believe we all need to sacrifice. And we would blend it in. It wouldn't be something if you're 64 or 60 or 59, 64, all of a sudden you don't get Social Security next year. I think it should start with people who are 50 when the bill passes. So it would be something that we would give people time to prepare for. And as we have a vibrant economy, as we have a growing stock market for people, if they want to retire early, there should be no penalties for retiring earlier. They're just not going to get their government Social Security check earlier. I want to make sure that Social Security is there today and tomorrow. And what we've done from the 1930s to today, we haven't done anything to make it sustainable. We've allowed it to continue on its trend, and as the 21st century realities have come to bear fiscally, it's no longer sustainable. We have to fix it. And that's why I talk about we need to be the next great generation, because all of us are going to have to pitch in and help to solve this problem. All of us.
Thank you.
I'm very much against the privatization of Social Security. I fought it very hard when George Bush suggested it, and he ran around the country trying to convince the country it was a good idea. I think America has gotten a terrible lesson out of the financial collapse of the markets. People lost 40, 50% of their 401k plans. Social Security didn't lose a dime. And now the Republican platform of this Congress, this plan, the young guns in Congress, the people with the new ideas have a very old idea: to turn Social Security into a 401k plan and let people take their best chances. My concern is that Mr. Tubbs is about bringing to Washington a majority that believes that that's absolutely critical. They would take Social Security and put it at risk. They would take Medicare and make it into a voucher program. Do the best you can. Shop for an individual policy as a senior citizen. This is outrageous. Social Security and Medicare has done more to lift the generation, multiple generations, out of poverty than anything this nation did. And now they say, well, what we'll do is we'll extend the working age till 70. A lot of guys in three-button suits on Wall Street saying we're going to extend the working age to 70. People in big banks, the working age to 70. Guys sitting around a microphone in a radio station saying, I think people can work for 70. See these people over here? They work on high steel in wind and rain. They work tough jobs. You know what? The people suggesting that it should go to 70, little courtesy would be appreciated. Little courtesy would be appreciated.
Shut up.
Yeah, you guys gotta have some class. If you expect us to have class, you guys
You guys, please.
So let's go.
I would ask everyone to be courteous of everyone, please. Each side is getting equal time, please.
While they're raising the retirement age to 70, while they're privatizing Social Security, while they're outsourcing jobs and giving tax incentives, while they've decided that Medicare is going to be a voucher, they also want to give a tax break to people who make more than $250,000. The richest 2% of the people in this country, they're going to spend $700 billion of deficit. They're going to balance the budget, but first they're going to give away $700 billion of deficit to the richest people in this country. Something just doesn't add up here. I appreciate Rick. He wants to be on the good side of every issue. It just doesn't add up.
Thank you.
It doesn't add up.
Congressman Miller, the issue of health care reform. What is your stance on the health care reform? And more importantly, does it go far enough, and who is going to end up paying for this?
The users of the system are going to pay for this system. Right now, there's a $1,000 tax on most people's health insurance policies because of the uninsured people in this country. In California, it's even a little bit higher, according to Blue Cross and Kaiser and others who look at these health care costs. This is a very important piece of legislation because this brings health care security to millions of American families. Never again, and for the young people listening to this, there's going to be economic up and downs, but never again will you lose your health care if you lose your job. Never again will an insurance company tell you when you announce to them that you need treatments for cancer, they're going to take your policy away. Or they're only going to pay $10,000 and then you're done. Or they're only going to pay a lifetime limit of $200,000 and you're done. Never again are they going to kick your kids off because they turn 19. Even though they're not sick, they're among the healthiest part of our age brackets in this country, but they kicked them off. Starting Monday of next week, open enrollment in Kaiser, your children can come back onto that policy until age 26. These are huge changes for working families. These are huge changes for the economic security of people in this country. I'm very proud of that legislation. We've already saved just in the enhanced waste and fraud provisions, one of which I wrote after the 60 Minutes piece. Since the enactment of the legislation, over $2 billion has just been collected in waste and fraud, and I think there was another major announcement today about a sting operation for people who abuse this system. So this makes fundamental changes, but it brings people into affordable care, and it keeps that care available to them, accessible to them. 50% of the bankruptcies in this country are impacted in a major way because of a medical event that a family or an individual simply could not handle. They could not handle. So what did they do? They started to put it on their credit card. And then we know the rest of the story. Families should know that they have the financial security, that medical care will be there for them, their spouse, their children, their parents when they need it. It's an absolute hallmark of economic security in this country. And we've provided small businesses are getting a tax credit this year before the plan ever starts. That tax credit goes up to 50%. It's going to be a system that's going to be a great help to millions and millions of Americans. Remember what the trend was before. The trend was before companies were getting rid of health insurance. They were putting more and more cost onto their workers and to their families, premiums, co-payments, deductibles, and that was the trend. Small businesses weren't offering. It's been going on for 10 years. These businesses have been coming saying something has to be done. You cannot continue this way. They wanted this as much as anybody else. They wanted this as much as anybody else. Now it's very interesting in the polls as the people learn more about it. A majority of the people now support it. It wasn't very popular when we passed it. It wasn't about being popular. It was about doing something for the nation. And 70% of the people think we should do more.
Thank you.
Yeah, I'm one of those 70%. I think we need to do more on health care. First we need to do is repeal it. and then replace it with something that makes sense, that's sustainable, that we can afford, that helps the healthcare industry and doesn't hurt it. There are some good things in that healthcare bill, and we'll keep them. But when you add 159 new agencies, 16,000 IRS workers, that's a lot of money, and none of them are giving you a Band-Aid, doing surgery on you, providing any kind of health care whatsoever to you. This bill was sold on the idea that it's going to be cheaper, we're going to save money. That's how it was sold to us. And that it's going to cover everybody. It's going to solve the uninsurance problem. We just heard it's going to save us $1,000 because we're going to insure everybody. Well, let's take a look at that first thing. Congressional Budget Office says in 2019, when this bill is fully in place, there will still be $23 million, or 23 million people uninsured. That's the CBO's estimate. So we're really not saving that $1,000. Next, it's a bill. You did these wonderful things, increase the age to 26, pre-existing conditions, preventative care, uninsured, unlimited caps. All that stuff costs money. It costs money, and we see it right now. Our insurance premiums are going up directly in response to this new health care bill. We have already wavered 1 million workers out of this program from over 30 companies, and these are the companies that have people that had the time to go into it and figure it out. There is a big wave behind this of people that are going to need to be wavered out of this program because it's going to cost them too much money. This was supposed to help the little guys, save guys like me and your family's money. But all I'm seeing is it's costing me money. It's costing us more, and that's what we have to fix. I'm one of those 70%. Repeal, replace with something that works. Thank you.
Thank you.